Microneedling and laser skin resurfacing are two great options for improving the aesthetic appearance on your skin, but finding out which one is better requires knowing what the purpose of each of them are used for, as well as weighing the pros and cons. In this video, we're going to do just that, so you can find out which one you should go with. If you guys are new here, this channel is all about helping you make informed decisions, as well as be in the know when it comes to your health and wellness, and I would love for you all to gently tap on the like button down below. And if you really like the content, then consider hitting that subscribe button as well. Also, if you guys are on Instagram, you can follow me there too. Now, without wasting any more time, let's dive right in. Now, there's a big difference between laser resurfacing treatments and microneedling, and it all comes down to how these treatments are going to work. For lasers, remember, they use light as energy to specifically target an area on the skin you're trying to treat. Broken red veins or dark spots, for example. The reason why it's targeted is so that we don't damage any of the surrounding tissue. So think of this as your selective treatment. And you got two main types for the most part. Your ablative or non-ablative lasers. An ablative laser will remove the outer layer of the skin by heating up the dermis layer and stimulating the production of collagen as the skin starts to heal back up. A non-ablative laser does not damage the skin, but can still stimulate collagen growth, but obviously isn't as effective on deeper rooted skin issues. Microneedling, on the other hand, is the mechanical method of creating thousands of tiny channels known as injury all over a treatment area, which will then force the skin to heal. But don't be too worried, because the holes are microscopic and they're just made enough to just trigger your skin's trauma response. Unlike lasers, on the other hand, the results won't be selective to that specific problem. But the advantage is you can see improvement in many issues caused by a slowdown of collagen production. This will then lead to more collagen regeneration and skin turnover once all that healing is complete. Now that we got the function of each of these out of the way, let's weigh the pros and cons of each of them. Let's start out with lasers. The first is that you'll have a faster result with lasers because of how drastic the changes are to the skin when they heal. So if you're looking to treat spots, skin texture, and large pores, lasers may be a good choice for you. The second pro is that the results last longer. After the skin heals itself, expect the effects to last several years. The cons, however, are that they are generally more expensive to get done. Currently, microneedling costs around $200 to $700 per session, but lasers, on the other hand, can cost $2,000 for an ablative laser and $1,500 for a non-ablative procedure. The second con of lasers is that there's more downtime to recovery. Ablative laser treatments have much larger wounds and will require a few days to recover versus with microneedling, which can be quick. If I were to add another con to lasers, it would have to be that discoloration can occur. I know you might be going in and getting laser treatment for discoloration in the first place, but know that lasers do have the risk of causing discoloration as well, and darker skin types are more prone to it than lighter ones. Now let's take a look at the pros for microneedling. The first pro is actually for your skincare routine. The micro channels left from microneedling can actually help your skincare products go in deeper, making them more effective. The second pro is that since it doesn't use heat energy, darker skin types don't have to worry about discoloration after the procedure versus with lasers. But the cons are that you won't see any changes for some time. It may take weeks and multiple sessions before you do. The second con, which I think is a huge one to pay attention, especially if you're trying them out at home, which, by the way, I don't recommend for reasons I've talked about in this video, which you should watch after this one. It's not for those with bacterial skin infections. So if you have acne, eczema, or psoriasis, you don't want to introduce the bacteria into these tiny microchannels that you create with microneedling, because you can cause infection. What if you wanted to use the power of both these treatments? The good news is that you can, but I would not recommend doing them on the same day. Maybe alternate them monthly to avoid the risk of overstimulating the face. Personally, for me, and this is just my opinion, because I have darker skin, I would try out microneedling that is combined with PRP, or platelet-rich plasma, which is known to help with getting your results as well as improving healing time. This is because PRP is full of platelets and growth factors, because they're using your own blood to make it happen. Ideally 4 to 6 treatments 4 weeks apart is sufficient enough to maintain collagen production that you're trying to get using it with PRP. This is also a good treatment if you're trying to treat acne scars when your products have failed you. Just be sure that when you do try these treatments out, you follow the right recovery plan, after which the office will give you, depending on which procedure that you go with. Click that subscribe button down below if you found any value in this video, and share with me your thoughts. Have you tried microneedling or lasers before? What was your experience like? And until then, guys, I'll see you on the next one.